interdisciplinary, innovative and interactive allergy solution. As far as allergy is concerned, it begins in the childhood, it goes across the ages. It enters into the childhood, it enters into teens, it enters into the adults and elderly and up to 100 years. This is like a sprout from the seed, it becomes a big tree. So then you see the Vishwarupa of the allergy. అలర్జీ అనేది చాలా కామనెస్ట్ ప్రాబ్లం ఇండియాలో. ప్రతి ముగ్గురులో ఒకళ్ళు ఏదో ఒక ఎలర్జీతో బాధపడుతున్నారు. ఎలర్జీ మీద అవేర్నెస్ అనేది గత 30 సంవత్సరాలుగా మేము కల్పించడం అనేది జరుగుతుంది. ఎంతకీ తగ్గని తుమ్ములు, జలుబు, దగ్గు, ఆయాసం, ఉరక ఇవన్నీ కూడా ఈ ఎలర్జీ అనేది ఏ ఒక్కరి స్పెషాలిటీ కాదు. ఎలర్జీ అనేది అందరి రెస్పాన్సిబిలిటీ అని చెప్పడమే ఐడియాస్ యొక్క ప్లాట్ఫామ్. ఈ యొక్క కాన్ఫరెన్స్ ని నేషనల్ లెవెల్లో 2026లో మేము కండక్ట్ చేయబోతున్నాం. ఈ సందర్భంగా వచ్చినటువంటి డిగ్నిటరీస్ అందరికీ కూడా మా యొక్క హృదయపూర్వకమైనటువంటి ధన్యవాదాలు తెలియజేస్తున్నాం.
Vishnu invited me. Actually, we are busy with some other program results. Today we have a new, very important function. Despite the fact that we are busy, I thought I should come here because the concept is so good. And I know Dr. Vishnu Veerapaneni since last 30 years. When I heard that he's coming to Hyderabad, I was surprised. What happened to him? He was such a busy practitioner there, seeing hundreds of patients every day. And for a practicing pediatrician, it's always the number counts. How many he sees? If he sees more, he is more respected. Some of them are there lifelong, but we can bring them great relief. Ultimately, relief is more important than the cure. Cure for somebody serious, but relief is equally important. So, we really congratulate Dr. Vishnu for doing this great, commendable job. I am proud to be associated with him since last 30 years. Because he is bringing relief to sick children, that is very important. So, congratulations and I wish you all a very happy day.
Senior knowing from 1990 and he is very dynamic and I went to his clinic also at whatever he is telling, most of the people, pediatricians, they now when we were taught, all these are not there. 40 years back, they are different now. So everything will be linked to some way of allergy. So why there is a lot of lifestyle modification, lifestyle these changes for last for over 40 years. If you see why, how we raised, how we brought up, and how we are raising our children, that makes a lot of difference. So definitely, allergy is the major issue nowadays for all the children. I hope Vishnu Rao will address those and definitely as the incoming president of IITC, actually when I elected, he told we should do an active day. Definitely we are going to do with SWASA and ideas. We will spread the message. Thank you. Vishnu.
It's a great opportunity to work for you to give SWASA to this SWASA Foundation so that we will work a lot. So that we will really create so much breathe, unified breathe for everyone. Thank you very much, sir. It's a great opportunity to know about you. Even though I know him before Vivek, I know him. But it's really great to come over here to address this gathering and to know a lot about it. And as you rightly said, treat the root, not the fruits. Thank you.
So to continue this legacy, Dr. Vivek entered into this field and he is expanding the hospital to a 50-bedded exclusive respiratory center for both children and adults. And it is first of its kind, it's an exclusive center. Allergy work, immunology work, and ICU and interventions. So he is so much passion, more than me. He is actually stressing himself because of the patient load and all these things. And we don't know how to address this load since so many patients are pouring with the. Then we realized this is the number one problem in the world. If you rightly connect it to the patient, sir, whatever you are telling in the social media, sir, I have this hyperactive children. When the nose is blocked, the child get irritated and hyperactive. What is the root cause for this hyperactivity? Untreated, unidentified allergies are the root cause for most of 80 to 90% of the hyperactivity. Where I am treating them, they are becoming silent, they are becoming normal. Even in autism also, the allergy is associated. That is why if you change the microbiome in a woman who is not married yet, but who is allergic, from there we have to take the care. From there, before she going to marry, we have to see whether she is having allergy or not. If she is having allergy, that means she is having bad bacteria in the gut. And the same bacteria will be transmitted to the baby also, same immunity. Now the science is developing so fast, we are entering into the gut check and gastroenterology area where the immunity is stationed. As he rightly mentioned, he treated that case. Even I don't know that he treated that case. Actually, I was burdened with the practice. Now he's concentrating on the development of this thing. And now I'm mainly focused on the SWASA Foundation, where our philosophy, at least my philosophy, treat one, aware all. Treat one. This is the concept. SWASA hospital is for treatment. SWASA Foundation is for awareness. I give examples in the social media also. If anybody falls in the well, you have to take him out. There you don't talk about the prevention. First you take him out. That is the duty of the hospital. If he is repeatedly falling in the well, it is a nonsense. Then we have to give the foundation. You have to build the parapet wall, not to fall into the well. That is more important. That is what I strongly believe in.
Gradually, my attention goes to the allergic diseases in childhood. Then I started a clinical observational study on 6,000 students. What exactly these children are using? What is the right treatment, inhaler treatment or fish medicine, at that time very rampant, and what are the conventional drugs they are using? Out of that 6,000 children, what I observed, I presented at the National Pulmonology Conference in Coimbatore, where I got a Young Scientist Award for that clinical presentation. That is says less than 2% of the children are getting the right treatment for asthma. Right treatment, right meter, like a lock and key. So asthma means everybody uses Asthalin inhaler. That is not the right treatment. So that 90% people may be using it. That is not the right treatment. Then conventional drugs 90% and 7 to 8% people are using fish medicine and all those things. And after those taking that, the suffering is there, what I identified, and the solution is there. Suffering is there, solution is there in the form of the drugs. The connecting link between the suffering and solution is missing. That is asthma education, which I take up. At that time, right to breathe equal. In 98, there is a call coming from the WHO, right to breathe equal. Everybody has a right to breathe equally. That actually attracted my attention. Then I totally involved into the pediatric allergy. I traveled along with the disease into the adults one. So in that juncture, I traveled as a pediatrician. So I have seen the nose manifestations, ear manifestations, skin manifestations, lung manifestations, GIT manifestations, and the similar thing in the adult life also. When I am connecting with these organs and everything, then I thought subsequently, okay, it is better to have a platform where all the specialists comes under one platform. Then I developed a interdisciplinary interactive allergy solutions or innovative allergy solutions or interventional allergy solutions in the form of allergy operations also sometimes. So this is the thing. Since allergy, as Dr. Vivek told, is the most commonest problem in the humanity. One in 3 people are suffering with one or other allergy, whether it's eye allergy or nose allergy or skin allergy or lung allergy, otherwise known as asthma, or gastrointestinal allergy, whatever, neurology, migraines or neuroallergies. So these are all the things. So then I thought allergy is no longer a condition confined to one organ, one specialty. It is a chameleon appearing in the skin, lungs, gut, eyes, even nervous system, in the joints and so many sites. Allergy is no man's specialty. Here is the big thing. Allergy is a no man's specialty. It crosses the borders because the human being holds all the systems within. So it is not separate. So it is every specialist's responsibility. Ideas is unified platform where specialties converge and insights are shared, and the collaborative care becomes the standard for the patient. Let us move from the isolated interventions to integrated intelligence. So, and breathe new life into how we understand allergy, how we diagnose allergy, how we manage allergic diseases. Why ideas? So this is allergies don't follow departmental boundaries. They don't know. They cross all the systems. Share, but trigger is same. Either pollen or dust mites or foods or infections, whatever. The pathways are the same, linking all the organs. Ideas brings here together to listen, understand and act, ensuring patients are not treated in isolated fragments. So the problem, fragmented care and siloed systems. Suppose ENT is different, lung is different, skin is different, and gastrointestinal they are siloed. Yavariki vare yamuna tire. So we are involving in our own specialty and we are not sharing the data. If you don't share the data, what is happening we don't know. When they are isolated, the patient will suffer. So allergic diseases demand collaboration. Allergic diseases, that doesn't mean that only ENT. Allergic disease doesn't mean that only lung. It doesn't mean that only skin. It doesn't mean that only GIT. Allergy is the underlying immunological disorder where all organs are connected. So these are the things. In the center, the patient is there, fragmented care and siloed systems. So all the systems, the patient is connected to all the systems at a time. I have seen multiple patients since 30 years. The patient having allergic conjunctivitis, allergic rhinitis, infantile eczema, and at the same time asthma. We call it as an allergic march. It starts in the nose, ends in the lungs as asthma. So this is what I followed through my since 30 years of this thing. The vision, integrated, personalized, collaborative. So team-based, patient-centered models replace isolated care, ensuring every aspect of patient's condition is addressed. Focus on immune-informed diagnosis. Immunology is the crucial factor. So that is the most important. So prevention first thinking, precision therapy tailored to individual boundaries dissolve and knowledge flows. That is the most important, not just treat separate parts. We cannot piecemeal the patient. If the patient is one as a whole person, we have to treat the person there, not only the disease, because even the disease carries the psychological burden also, and we have to even address that also. So this is my intention from the beginning. So this is the vision, integrated, personalized, collaborative care. This is the approach. So connecting specialists to solve the puzzle. Every specialist is holding their own piece of puzzle. They only see that puzzle. But when you integrate all these puzzles, then you get the grand picture. Just like there is a story, some blind people see the elephant. Some says, only legs, how they describe each part. But when they see a bird's eye view, oh, this is elephant, then they get surprised. Just like that, allergy Vishwarupani Chusanam, allergy of Vishwarupam. Once upon a time, on our times, if you know syphilis, you know medicine. 10 years are this thing, if you know diabetes, you know medicine. Now I am very confidently say, if you know allergy, you know medicine. So this is the present trend going in the world because allergy is rising along with the pollution and everything. So connecting specialists to solve the puzzle is very, very important. So multidisciplinary network, a unified platform connecting 9 key specialties: ENT, pulmonology, dermatology, pediatrics, gastroenterology, neurology, ophthalmology, immunology and general practice, and rheumatology also, and psychiatry also, and psychology. There are so many other things are there. So this is all the things. So network, tools and innovations are improved. This is the approach, connecting all the specialists through immune network. Immunology is the number one. unfortunately in India, so there is no degree on immunology. Recently they are introducing at the VIP Chess Center, if at all any degrees are more, it should be allergy. Allergy degree should be more, actually. But there is no degree. Because there is no understanding of allergy in this, anywhere in the world. Because the person who suffers with allergy, sneezing, what is their sneezing? If you ask that person, sir, it is better to die rather than sneeze every day. They only know what is the suffering. But it is a very big subject actually if you explore it. Then you see the Vishwarupa of the allergy. First, pediatrics. As a pediatrician, to start with, I have seen all the cases, mostly allergy. Then I followed the pediatric. Then where allergy often present first is the nose. First, when this allergic rhinitis begins, a 3 months old child, who is the first person to diagnose is the mother. It is not the doctor. It is the mother. If you go very deep into the history, it is the mother, it is never the doctor. Mother comes and says, sir, in the night, I find my child is not breathing properly something is happening somewhere in the nose. Then, if they present to young physician, not to experienced, then they play very well in front of in the clinic chamber. Why you are so anxious? You are a young mother, you don't know anything. So this is common. Then she don't know to whom to share. These are all the things which makes you to think, while she is taking the breastfeeding, she leave the breast and take for some time and again she takes the breath. So along with other diseases also there are cardiac diseases which cause this, but allergy is the most common one. There some rash will appear here on the cheeks as an infantile eczema, on the here and here in the back and the flexor areas. If you see the entire area clearly, then you understand some allergy process is undergoing. Allergy means discomfort. Allergy means disturbance. That disturbance first identified the mother, not by the doctor. So across allergy specialties, but care often remains fragmented. Patients bounce between the ENT, pulmonology, dermatology and other people. This mother goes to many doctors when the problem is not solved. When this young doctor said, no, this is okay. No, this doctor is not able to understand my child problem. Let me go to ENT doctor. Then they go to ENT. And then suddenly they go to the dermatology also. They go to pulmonology for asthma. So they keep on shopping every specialty. So what is the solution for this? The ideas, interdisciplinarity, interactive allergy solutions provides a platform to connect the specialties. Suppose there are all specialties are sitting here. As a pediatrician I am talking, or an ENT surgeon I am talking my perspective, my area, then other doctors will be connected to that. So provides platform to connecting specialties, shared insights, coordinated care. We bring ENT into active collaboration with pediatrics, pulmonology, dermatology and immunology for shared and comprehensive view. So these are the ENT is often the first point of contact for allergic patients. With ideas, you don't just treat the nose, you help heal the whole person by addressing the root of the inflammation. The allergic inflammation is the root. This is how it looks. Inflammation means inflammation. Flame is there in that. Flame. Jwala. Yantaki arani jwala. Allergy, then atla define chestanu. Yantaki swasalo yantaki arani jwala. The fire in the breath. I define it as the fire, the continuous fire in the breath, which goes from nose down to the lungs. This fire involves, this kind of fire will disturb the person. Then nerves are there. So neuroinflammation, they present as a headaches. And migraine, we brand it as migraine. The patient goes to neurologist and they get all kinds of CT scans and everything, forgetting about the immunology. Unless you treat the root cause, nobody can treat it. So many patients are there like that. So this program mainly I intended for the postgraduates and the young doctors, not the doctors who are already there, who are very experienced, they know everything. But this is my idea which I am sharing to the young doctors. So that when they come into the practice, they look in the whole perspective rather than the siloed systems. So this is the dermatology again. So skin as the first messenger. Infantile eczema may be the first presentation of allergy in a baby of 3 months old. This rash, then you have to think some allergic process is going in the body, and we have to alert the parents. You have to continue the breastfeeding, don't give top feeds. These kind of things, this is the forerunner of asthma. So you have to be careful as far as indoor pollutions are concerned, like agarbatti or perfumes or dust mites or everything. We have to warn that parents, be careful, this may convert into asthma later. This can go to nose problem, this can go to ear problem, this can go to throat problem, and later it may end up with snoring also. So one skin, that is the point we have to, these are the very subtle pointers. So pointing towards the this thing, these are the allergy. This may appear superficially, but at the depth there is something else. Like this is only tip of the iceberg. So pulmonology, breathing allergy burden, asthma, cough-variant asthma, recurrent cough, allergic bronchitis, chronic wheezing, exercise, so many names are there, but underlying is only thing immunology. So respiratory allergies rarely exist in isolation. They don't present just like asthma, no. They already have allergic rhinitis. They may be having skin problems. They may be having eye problems. They may be having migraine problems, so many problems. They often stem from or coexist with ENT, skin, gut issues, and trigger like pollens and dust mites are shared across systems. United airway disease, which I am practicing. United, one airway, one disease. One airway, one disease. This is my concept of treating the patients. So we coordinate trigger control, immunotherapy considerations, comorbidity management by linking pulmonology, ENT, all these things. Now, this above is the nose and below is the acidity, gastrointestinal presentation. One of the presentation is acidity in allergy. Some patients always belchings, bloatings, and IBS kind thing. After eating something, they get disturbed. Upper is this one and lower is the acidity. In the middle sandwich is the lungs. Lungs are sandwiched. If you treat only asthma, forgetting about the fixing nose and acidity, you are giving incomplete treatment. They never get better. So at the same time, you have to fix the sneeze and treat the wheeze. You have to fix, at the same time, you have to fix the acidity also. Any other problems also, you have to fix it. If you don't understand by yourself, you have to refer the patient or you have to take the inputs from the other specialties. But finally, we have to do justice to the patient. That is the motto. So these are the normal lungs, these are the inflamed lungs. That flame, I was explaining. This is the flame, continuous flame, that is called chronic allergic inflammation in the breathing tubes is asthma. This will be there for lifetime if you don't treat. And these patients want to die every day. If you ask them questions, if anybody come and sit in my clinic, they will cry. When I explore the patients, సార్ ఎందుకు సార్ ఈ బతుకు ఒక్కసారి పోతే బాగుండు కొన్ని వందల మంది కొన్ని వేల సార్లు అంటుంటారు బట్ దే లుక్ నార్మల్ అవుట్ సైడ్ ద ఇంటెన్సిటీ ఆఫ్ ద ప్రాబ్లమ్ nobody understands. If you understand, then it will be something different as far as treatment is concerned and management is concerned. So gastroenterology, this is the biggest storehouse of immunity. 70% of immune cells are posted in the gastroenterology area, and rest of the things are throughout the body. 20% in nose, adenoids, and tonsils, and these are the stations where immune cells, security officers are placed. These are all the security system of the body. This gastroenterology, suppose, they teach the tolerance. They teach tolerance to the immune cells. Who teach? Suppose we are there in the immune classroom. Suppose gastroenterology is like an immune classroom. there is a teacher who is a microbiome and immune cells are the students. Suppose if teacher is good, they teach the students how to be tolerant. So what to react, how to respond, they will teach. If the teacher himself spoiled by the food, the microbiome is the bacteria which is called good bacteria. When the baby comes through the mother's birth canal, then actually this bacteria is engulfed by the baby. They take all the secretions into this, that is the seeding of the bacteria. Within few days, that goes to millions and billions and trillions, this bacteria. When mother feeds, these bacteria felt very happy. They are the good bacteria. That is called good microbiome. The same baby, if you feed, if the top feeds, then it become a bad bacteria will develop that. That is dysbiosis. So suppose this microbiome is like a teacher, then he will teach the immune system to the immune cells how to be tolerant. If teacher himself is disturbed, students also get disturbed, and this enters into all other systems, into the lungs, into the skin, into the nose. So now the root of all allergy lies in the intestines. So that is the thing where we have to address these problems. So eosinophilic esophagitis. Patients comes, sir, nenu tintunta naku edo patteshinattu unta sir ikkada. I'm not able to, something is there, I can't swallow it properly. Same allergy patient, may be suffering with asthma, allergic rhinitis, and this one and this also. So eosinophilic esophagitis, that is inflamed esophagus. When the food goes through them, how he feels, they only know. We don't know how they feel. But we have to address that feeling. That is more important. Now the present generation is type 2 immunity. అంటే ఒక విధంగా చెప్పాలంటే ఇమ్యూనిటీ గురించి ఒకప్పుడు ఓల్డ్ జనరేషన్ అంతా నాటుకోళ్ళు, ఇప్పుడు ఉన్నాయన్నీ ఫామ్ కోళ్ళు. దే ఆర్ సో సెన్సిటివ్ బికాస్ ఆఫ్ ఫుడ్ హ్యాబిట్స్ అండ్ ఎక్స్పోజ్డ్ ఎన్విరాన్మెంట్స్ ఆర్ డిఫరెంట్. సో దిస్ ఈస్ ద TH1 immunity, type 1 and type 2, and this is protective immunity which comes through the immunotherapy. This is what we are doing, immunotherapy. So this is, now the general practitioner is exposed to all kinds of people. He see all people. Today only I started my practice. With that much of enthusiasm, I involve in the allergy care. That's why people don't understand me. Vishnu Rao treat nose, Vishnu Rao treat eyes, Vishnu Rao treat that, Vishnu Rao treat this. No, I am treating allergy. I am treating allergy. So I am treating the person. So how you do is more important. How you do is unique for every individual in this world. What you do is unique. Vishnu Rao maybe do it differently. Vijay Kumar do it differently. So that is how we differentiate person to person. What you do is a common thing. Why you are do gives always satisfaction. How you do is the method. What method you follow. So like that. So in the police language, if we talk, there is east zone, west zone, south zone and north zone in Hyderabad. No, east zone issues I don't bother. No, Hyderabad is a single unit, and definitely departmental discussions must be there for you. So whatever is there. So just like that, interspeciality discussions must be there to address there the security of the Hyderabad, here the welfare of the patient. So this is what I want to say.
ఇండస్ట్రీలో కమిట్మెంట్ ఇష్యూస్ వస్తే నీకు కూడా వచ్చినట్టు
మార్నింగ్ తీసుకెళ్ళానంటే కొట్టి పడేస్తారు.
ఒక్కళ్ళు కూడా చూడలేదు ఈ సినిమా అని చెప్పడానికి కూడా చాలా ధైర్యం కావాలి.
అది నిజం కదా, దాంట్లో ధైర్యం ఏంటి?
నెక్స్ట్ డే ప్లేట్ మార్చేస్తే తప్పు కదా.
యాజ్ ఆఫ్ నౌ వీఆర్ కంఫర్టబుల్ దిస్ అని నేను అనుకుంటున్నాను.
రష్మిక గారిది మీది ఒకే ఊరు అంట కదా. నీకు కోపం వచ్చిందంటే బాగా తిట్టేత్తరా?
తిట్టేద్దామండి. నిజంగా గేమ్ ని ఎలా చేంజ్ చేయగలిగారు?
ఏపీఎస్ఎఫ్సి వాళ్ళకి 6 నెలల్లో నేను 6 లక్షలు కట్టా.
బిజినెస్ చేయాలనుకుంటే ఇట్ ఈస్ యాజ్ డిఫికల్ట్ యాజ్ రైడింగ్ ఎ టైగర్.